Think for a moment about something, well, incredibly simple, something you do hundreds of times a day without even thinking about it. Swallowing. It's just this fundamental process, isn't it? Your body just, it knows what to do. What happens when that most basic function, getting food and drink from your mouth to your stomach, becomes incredibly difficult or even impossible? Today, we're taking a deep dive into achalasia. It's a rare disorder of the food pipe that can turn a simple meal into, well, a monumental struggle. Our mission here isn't just going to be, listed facts. It's about unpacking the complexities of this condition, from its kind of mysterious causes and unsettling symptoms, right through to diagnosis and the treatments available. The goal is really for you, the listener, to walk away well-informed about something many might never have heard of, understanding not just what it is, but why it matters.
Exactly. And while achalasia you're right, it's rare, looking into conditions like this gives us such profound insight into the body's intricate systems, the ones we often take for granted. It really highlights how important it is to pay attention to even those, subtle signals our bodies send us. And for those directly affected, this kind of knowledge isn't just interesting, it's genuinely life-changing. It offers a way to manage a deeply disruptive condition.
Okay, so let's unpack this then, before we get into what goes wrong. How is swallowing actually supposed to work? What's that beautifully coordinated dance you mentioned before?
Yeah, that's a great place to start because it really shows the complexity. In a healthy body, it's this beautifully orchestrated sequence. First, the muscles in your esophagus, that's your food pipe, they contract in this rhythmic, wave-like motion, almost like squeezing toothpaste down a tube, pushing food toward your stomach. Then there's a crucial little ring of muscle right at the very bottom of the food pipe. It's called the lower esophageal sphincter. And it needs to relax. It needs to open up just at the right time. This lets the food pass smoothly into your stomach. It's sort of elegant in its simplicity, really, but it depends on precise timing and nerve signals.
And so in achalasia, that elegant dance, it completely falls apart, doesn't it?
Precisely. That elegant dance goes completely awry. The esophagus muscles, they don't contract correctly. They might spasm erratically or maybe not contract much at all. They can't effectively push food along. And that ring of muscle at the end, the sphincter, instead of relaxing and opening like it should, it stays tightly closed. Or maybe it only partially opens. So food and drink, instead of flowing smoothly into the stomach, they just get stuck. It often ends up being brought back up, which, as you can imagine, is incredibly distressing. And it often leads to other complications, too.
Oh, it sounds truly awful. So is difficulty swallowing the first sign? Or can this condition kind of sneak up on you with maybe more subtle symptoms?
That's an interesting point because, no, not everyone with achalasia will have obvious symptoms right away. But for most people, yes, difficulty swallowing, dysphagia is the medical term that becomes the hallmark symptom. And it often gets gradually worse, sometimes over years, eventually can feel almost impossible to eat or drink anything.
And beyond that main difficulty, what else happens?
Well, there's a whole cascade of other significant symptoms. People often bring back up undigested food. They might experience choking and coughing fits, suffer from heartburn, chest pain. Repeated chest infections are also quite common. Drooling of vomit or saliva too. And gradually, but significantly, weight loss over time. And these symptoms, they can really start at any point in life.
Wow. So it covers a lot.
It does. And here's something really striking, actually. The critical connection this has to other potentially serious conditions. We need to remember that swallowing problems aren't always achalasia. They can also be caused by cancers of the mouth, throat, and esophagus. And while the risk is small, there's a link between long-term achalasia and a slightly increased risk of developing esophageal cancer later on.
That's sobering.
It is. And it raises a really important question for all of us, doesn't it? About vigilance. The critical importance of getting any new or persistent symptoms checked out immediately, even if they don't seem that bothersome at the time. Being vigilant about changes in your body is just key to catching serious issues early.
Absolutely. That potential for complications is, sobering. Which leads us right to the fundamental question, what is actually behind achalasia? What do we know about what causes this nerve damage?
It's one of those enduring medical mysteries, unfortunately. For a condition that so fundamentally disrupts daily life, we still haven't pinpointed a definitive smoking gun cause in most cases. What we do know is that it happens when the nerves in the esophagus become damaged. They just stop functioning properly, and that then leads to the muscle and the sphincter malfunction we talked about. So while the exact cause of that initial nerve damage is largely unknown, we do have some suspected contributing factors.
Okay. What sort of factors are we talking about?
Well, for some people, there seems to be a potential link to viral infections. almost as if a virus might somehow trigger the initial nerve damage. We're not sure, but it's a possibility. It might also be associated with autoimmune conditions, where the body's own immune system mistakenly attacks healthy cells. In this case, maybe those crucial nerves in the esophagus. And then in very rare cases, it's thought that maybe a faulty gene could be the underlying cause.
So it could be a few different things.
Potentially. And here's where it gets really interesting, I think. Aclasia truly underscores this humbling truth about our bodies. A microscopic nerve pathway, honestly no bigger than a thread, can completely derail something as fundamental as eating. It's not just about a muscle failing, it's about the brain's subtle command system going silent in one tiny but crucial spot. It just highlights how many complex systems the body relies on, and how a seemingly small disruption in one area can have such a profound impact.
That's a fascinating way to put it. So, given that the symptoms can mimic other conditions and, as you said, the potential for serious complications, how is aclasia actually identified? What's that diagnostic journey like? I imagine it typically starts with a GP visit and then a referral to a hospital for more specialized tests.
That's generally the path, yes.
Yeah.
Once a referral comes through, the real sort of detective work begins. There are a few specialized tests needed to rule out other conditions and confirm aclasia. And sometimes you're right, it is diagnosed incidentally. Someone might be having investigations for something else entirely, maybe a chest x-ray, and it gets picked up. But the specific diagnostic tests are crucial. First up, there's something called manometry.
Manometry? What does that involve?
It involves passing a small, thin plastic tube, either through your mouth or sometimes your nose, down into your esophagus. This tube is designed to measure the pressure. The pressure exerted by the esophageal muscles at various points as you swallow. It shows how well they're contracting, or, importantly, if that lower sphincter muscle isn't relaxing like it should.
Okay, so it's measuring the force and coordination of the muscles.
Exactly. Then there's the barium swallow. For this test, you drink a white liquid that contains barium. Barium shows up really clearly on x-rays. So as you swallow it, they take x-ray images. They observe how quickly, or more likely in aclasia, how slowly that liquid moves down into your stomach. And crucially, if it's getting held up at that lower muscle.
Right, you can actually see it getting stuck.
You can often see the holdup, yes.
Okay.
And finally, there's endoscopy. This involves passing a thin, flexible instrument, it's called an endoscope, down your throat. It has a light and a camera on the end. This lets the doctor get a direct look, a visual inspection, of the lining of your esophagus, that problematic ring of muscle, and also your stomach. They're looking for any physical abnormalities or ruling out other potential causes for the symptoms.
Got it. So manometry, barium swallow, endoscopy, that seems pretty thorough. So once aclasia is diagnosed, is there a cure? Or are we looking more at long-term management and symptom relief?
Yeah, unfortunately, there isn't a cure for aclasia at the moment. The nerve damage, once it's happened, we can't reverse it currently. However, the good news, and it is good news, is that there are very effective treatments available. Treatments that relieve symptoms and make swallowing significantly easier. Doctors will always discuss the various options, the risks and benefits of each with you. The focus is definitely on managing symptoms and improving quality of life.
Okay, so what are those approaches?
Well, first, there are medicines, things like nitrates or a drug called nifedipine. You can think of these as chemical signals that basically tell those stubborn esophagus muscles, especially the lower sphincter, to relax a bit. For some people, this makes swallowing a little easier, maybe less painful, but they don't work for everyone. And the effect is often quite short-lived. So medicine is frequently used as more of a temporary measure, maybe while waiting for a more permanent treatment. They can cause headaches sometimes, that's a known side effect, but that usually gets better over time.
Okay, so medication is one option, maybe temporary. What else?
Next, there's a procedure called stretching the muscle, or balloon dilation. This is usually done under sedation, sometimes a general anesthetic. A balloon is passed into the esophagus using an endoscope. Once it's in the right place, at that tight muscle ring, the balloon is carefully inflated. This physically stretches the muscle, essentially forcing it open wider.
Does that work well?
We connect this to the bigger picture. Yes, it's often very effective in improving swallowing for most people. It allows food to pass more easily. However, it sometimes needs to be done more than once. You might need multiple sessions to get the full, lasting benefit. And it's really important to be aware there's a small risk with balloon dilation, a risk of tearing the esophagus wall. It's called an esophageal rupture. That happens, it's serious and might require emergency surgery to repair it. Small risk, but it's there.
Right. Important to know. Okay, what other options are there?
Then we have Botox injection. Yes, the same Botox used for wrinkles. Using an endoscope, Botox is injected directly into that ring of muscle, the lower esophageal sphincter. What it does is temporarily paralyze and relax the muscle fibers. So it achieves a similar effect to the medicines or the dilation, just via a different mechanism. It's usually effective for a few months, maybe up to a couple of years in some cases, but it does have to be repeated as the Botox wears off eventually. It's generally painless, and it can be a really useful option, especially for temporary relief or for people who maybe aren't suitable candidates for other, more invasive treatments.
Interesting. So medicines, stretching, Botox, is there a surgical option too?
Yes, there is. And finally, there's surgery, specifically a procedure called Heller's myotomy. This is usually done using keyhole surgery or laparoscopy. What the surgeon does is carefully cut the muscle fibers in that troublesome ring of muscle at the bottom of the esophagus. This is often seen as a more permanent solution to the blockage, and it can significantly ease swallowing difficulties for many people long term.
Cutting the muscle, does that cause other problems?
That's a great question. Because you're essentially loosening the valve between the esophagus and the stomach, it can lead to increased acid reflux or heartburn. So it's actually quite common for surgeons to perform a second procedure at the same time as the Heller's myotomy. It's usually an anti-reflux operation, like a fundoplication, designed to prevent that very side effect. Your surgeon would definitely discuss this and any other surgical options that might be best for your specific situation.
Right. So what does this all mean for someone living with achalasia? It sounds like there really are tangible options, but each one has its own kind of pros and cons, doesn't it? From temporary relief with medication or Botox to more invasive but potentially more permanent solutions like dilation or surgery.
Precisely. It's about finding the right approach for the individual. And it's important to understand what life can be like after these treatments, too. As we just touched on, side effects like acid reflux and heartburn can happen after both balloon dilation and surgery. Sometimes persistent chest pain can occur too. A GP can often prescribe medicine to help manage these side effects, like proton pump inhibitors for reflux. Your surgeon might even suggest you take this medicine routinely after the procedure. And it's also quite normal for some chest pain to linger for a little while after treatment, just as the body heals and adjusts.
But what if the swallowing problems don't get better or they come back?
That's a key point. If swallowing difficulties or weight loss continue, or if they return after treatment has initially worked, it's always important to go back and see your GP or specialist. It might mean that further assessment or perhaps a different type of treatment is needed. It needs reassessing.
Okay. This deep dive has really shone a light on the immense complexity of the human body, hasn't it? Even in something we think of as simple, like swallowing. Achalasia, though rare, clearly has a huge impact on a fundamental life function. It turns a basic need into a daily struggle. But it's also clear that despite those challenges, there are established ways to diagnose it and a whole variety of treatments available that can significantly improve a person's quality of life. That offers real hope and relief.
Absolutely. I think the core message here is that knowing the symptoms, understanding the diagnostic process, understanding the treatment pathways, it can make a profound difference for those affected. It can really transform their experience of living with this condition. And for all of us, really, it highlights the intricate design of our bodies and maybe how much we often take for granted.
So, perhaps a final thought to leave you with. How many other seemingly simple bodily functions do we just go through our day completely unaware of? Unaware of the delicate balance that keeps them running smoothly until something like achalasia comes along and disrupts everything. It makes you think, doesn't it?
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.